was in the summer of 2021 that one of my patients, one of my telehealth patients, sent me an email to look at this new technology that was being designed for tinnitus. And that technology is called Tinearity out of Sweden. I got in touch with the founder, and today I'm talking to Peter Arndt in Sweden. Peter, please introduce yourself and give us some backstory about why you're helping the tinnitus community.
Yeah, my name is Peter Arndt. I have been having tinnitus for about 6-7 years. It started quite small, but then I get really annoyed about it. So my background is an engineer. I have been doing product development for many years. I have been doing projects with microelectronics and micromechanics. When the time was where I had it the worst, it was about 2015, 2016. I was involved in projects doing small AirPods and chargeable things. And I started treating myself with Tinearity, tinnitus retraining therapy. And I did it with a normal app in an iPhone and some earplugs. But that's quite hard to do for a long time. So I started to think about how can I solve this problem in a better way? And it ended up with a product we call Tinearity. And it's basically a device you put behind your ear and use your skull to listen instead for your ear. And that way you can get the white noise into the ear instead of using your ear inside the ear.
Thank you so much. Yeah, one reason I love that is because it's based on tinnitus retraining therapy, which is a standard therapy, a standard approach to help tinnitus patients. And I call it the best foundation, that most patients should be following this foundation of professional counseling, sound therapy, and high quality education about what is going on for an individual's case. And yeah, you're talking about bone conduction behind the ear. Everyone can feel that hard bone right behind the ear, and that's called the mastoid bone. When sound is played with a good contact to that bone, it sounds just like any other sound coming in through your ear because it's vibrating the little bones that are sending the waves through eventually to the auditory nerve and the hearing system. And tell us more about what happened next after you decided to create a technology for tinnitus. What did you learn along the way? And what is unique about your product? What have you decided is important to put inside of this technology?
It's basically the first product we are taking to the market is quite simple, actually. It just brings the white noise through bone conduction. But in the long run, we are going to make a system that we call Tinearity AI. And we hope to give the patients a better normal day, giving inputs regarding whether his tinnitus is going up or down, so the patient can control the life a little bit better. But for now, and as you said, Tinearity is the most common solution to treat yourself. And I started actually this project with doing quite a big research in many countries. And if you look into tinnitus, it's a big area, but you end up in nearly every country recommend Tinearity. So we went for that solution. I actually started this project quite early, about 2016, trying to finance it. And I actually got the finance too, but I was missing some parts of the product development team. So I had to wait a little bit to set the whole team. The second company I'm working with is in Sweden. It's a product development company. I'm a part owner in that and the CEO for that one. And I need a team to actually handle microelectronics and micromechanics, and also handle the quality system to make this a medical device. So it took me about 3 years to find a team. And the last piece was actually to find a good CEO for Duearity, and that's Fredrik Westman. And I got the team together spring last year.
Excellent. Tell us in your research of the existing technology that can provide sound therapy, what was important for you? Was it important to have something that was not in the ear, but on top or behind the ear? Was it important to have something that was rechargeable? Tell us about the important features and the benefits that they would provide, because you have lived this. This is not some concept in your head. You have lived this.
For me, it's nearly impossible to find the time to listen 6 to 8 hours to white noise during the day. I'm in a lot of meetings, it's a lot of telephone calls and so on. So the only time for me to treat myself was during the night. And as I said, I used a standard application in an iPhone generating the white noise. And then I slept with earplugs during the night. And I treated myself about 3-4 months. Then it was nearly impossible to sleep with earplugs such a long time. It's quite annoying. Actually, it really hurted in the end. So I quit the treatment, felt a little bit better anyway, and started thinking about how can I be treating myself during the day. And during that time, I was also involved in the bone conductive project. So that's the reason we use bone conductive technology. And that's also the main thing, that anyone can treat themselves and decide when during the day they're going to listen to 6 to 8 hours of the sound. So it's the freedom to treat yourself I was going for.
Excellent. Excellent. I had a patient recently who already had a bone anchored hearing aid, and we decided, hey, let's follow the sound therapy part of this retraining, and let's use sound therapy through your bone anchored hearing aid. So they were having the bone piece vibrate, and that was providing the sound therapy. And a technical question here for you guys: do you anticipate this product to be used on one ear or both ears? Because we do know that bone information through sound from one side can get to both ears, but there may be some benefits of doing both ears. Do you guys have plans for that yet?
We are going to sell it. The device looks like this. It's a patch and device itself.
Could you hold it a little closer to the screen, please?
Absolutely. It's like this. And this is the patch you use every day. This is the device and the charger. So after using it, you put 2 devices back on the plate and charge it the next day. We have chosen to go for 2 devices because the information regarding just using it on one side instead of 2, there is no information to get. So it's up to the patient to actually try it out. I tried it on a friend. He was deaf on one side, but he actually had tinnitus on that side. So he placed it on the other side and felt a little bit better about it. So we don't know, but we go for two devices.
And you have lived this. You have been in meetings. You have gone to restaurants, cafes where you probably needed some sound therapy to feel comfortable there. Why not hearing aids? Tell us about your perspective there.
In our board of directors, we have one woman. She is suffering from hearing problems. She told me she don't want to mix the treatments. She's really afraid of losing even more of her hearing. So she told us when she wants to listen, she goes for hearing aid device, and when she wants to treat herself with tinnitus, she would go for our device. So actually, during the day, she needs the hearing aid device, and during the night, she's going to treat us. And that sounds quite, I can get what she's saying. She's really afraid of losing more of her hearing. But I don't have an answer for more than that.
Yeah, I can give my perspective too, because I'm having these conversations with patients every day.
Yeah.
As you know, when you start to research what can help tinnitus, the patient takes on a lot of responsibility of trying to understand what is the right approach here. Hopefully they have a good doctor or they have a good medical team that can help them, but oftentimes not. And the conversations I have with patients and many other professionals have with patients, is number one, let's educate on what are the options for you. And if hearing aids are an option for whether the patient has a hearing loss or not, a device that looks like a hearing aid sitting up and behind the ear can present the sound therapy and follow TRT quite well.
Yeah, absolutely.
But to have an option of something that is more wearable technology that sits up behind the ear, it creates a new conversation. It has a new perspective on stigma, social stigma, and how will people perceive this hearing aid on my ear when I don't have a hearing loss. And now it's something different that sits behind the ear. It can start a conversation and potentially be a fashion statement or something that's welcome on the body. And would you like to comment on that? You work in this industry with wearable technology.
We have that discussion nearly every day because the hearing aid devices are going more for wearables and a statement too. We hope that this device will be a statement that I have decided to take control over my tinnitus situations. That's what we hope for. And actually, the patients we already are talking to, they are quite desperate. They just want to start the treatment. So in the long run, I don't think it's that much of a problem if it's a statement or not. It's too many people really suffering from tinnitus. But I think, we hope, and that's one reason we decided just to focus on tinnitus as an area itself, because you don't have any devices just focusing on that area. And actually, if you look into every country, there's no scientific studies going on. It's a quite narrow area where the scientist is focusing.
Yes, I agree. Remember the patient I talked about earlier? They had a bone anchored hearing aid actually because they had a certain type of hearing loss on one side of their ear. So they actually wore hearing aids for sound therapy, and they had this bone anchored hearing aid for sound therapy as well. And what we learned for them, because they had tinnitus and hyperacusis, or what's called sound sensitivity, and that in certain situations, they enjoyed the flexibility of just the Baha and then maybe earplugs, or the Baha and the tinnitus maskers, the hearing aids playing sound therapy. So I don't think it's always an hearing aids or bone sound therapy. It could be both or some combination. And like you said, with your colleague, giving some flexibility around that can only benefit the patient to have more options. So I'm happy to hear that. Tell us about right now in October 2021 and beyond, what is the most important thing for the development of Tinearity and your company, and what can we expect moving forward?
Actually, it's the certification. We're going for medical device classification 2A, and the regulations in Europe and the regulations in USA is quite complex. So we are mostly working with the quality questions to get CE marks. On the technical side, we are already in zero production state, we can say, trying out the tools and so on. And we have chosen the partners that we are going to produce it with. And then we also work a little bit with a logistics setup to send it to the patients. So it's on track, and we hope that we can release it somewhere in the beginning of next year, depending on FDA and the situation in Europe. They have actually changed the regulations from MDD to MDR, and it's a complex situation due to the fact there is a lack of competence to help us out.
Thank you for that update. I will certainly invite you on again closer to the launch of your product in the United States to explain it and educate. As we know, this is not for everyone. No. There's very few medical devices that will be for every single person with that condition. So it's important for us to educate on who are the groups that can benefit from this the most, and which groups are we not sure yet. I will definitely support you and your growing project here. Thank you so much for joining us. Personally, on a personal level, you have tinnitus. You've gone through challenging periods with tinnitus, I imagine. Do you have any words for the listeners, for the community here who may be at different parts of their journey with tinnitus?
Yeah, I actually recommended this to some patients phoning up with a really big issue. So I told him, or I always tell them, start with listening to white noise as fast as you can in a situation wherever you can do it. There are everything from pillows to earplugs and so on, but just start doing something with, for yourself regarding tinnitus. I also spent a lot of time in the nature. The sea is quite calming for me, and that relaxes me from tinnitus also. But as a starter, just do something for yourself.
Thank you, Peter.
Yeah.
This is Peter Arndt from Sweden. I am Ben Thompson, audiologist in the United States. Peter, thank you for joining. And if anyone wants to be in touch with Peter's project, where can they find you and maybe subscribe to an email list to stay up to date, Peter?
It's www.tinearity.com.
Tinearity.com, correct?
Yeah.
Perfect. Thank you so much, Peter. And for anyone listening, make sure to check out the other episodes of our podcast to learn more about tinnitus, different management solutions. Thank you. Goodbye.